Health professionals are aware that the chemical composition of many modern medicines come from natural sources, such as aspirin, which comes from the white willow. Today, some still harvest these natural sources and prepare their own medicine, but traditional methods run deeper than that. Thought, prayer, and medicine. The idea that there are more factors at play in one's health other than chemical composition, all play a role in traditional and holistic methods.
We believe that, and they do too, that in order for a person to heal from any kind of illness, whether it's emotional, physical, mental, or spiritual, they need all four aspects to be in balance within themselves.
In the First Nations community that I'm originally from, we have a traditional medicine program, and they use a lot of different approaches. They use cultural aspects as an approach to health. They use alternative therapies, naturopathic healing, massage therapy, Reiki, polarity, all of those sort of things get pulled in. And there is a good response. There's a really good response because it's something that's cutting edge. It's new, it's coming back. It's old traditions that are coming back. And as First Nations people, we need to hang on to our traditions, our culture, because that's who we are. And I think right now with the younger generation, they're not quite sure who they are, and that's where I think that's the root of a lot of social ills that are happening. So the traditional program plays a big role, but again, you have to realize where a patient is coming from. Some people just don't feel comfortable with that.
What we learn in university is very much Western style medicine. All the healthcare professions are like that, unfortunately. But we're also taught that one thing alone is not going to do it, right? There's all sorts of different avenues that someone's going to have to walk down if they want to really get a hold of what they're going through, whether it's heart disease or diabetes or depression or those sorts of things. I'm always a pharmacist, but when I'm at work, being a pharmacist, you know, as you would think a pharmacist is, I just have to appreciate that the way I was trained isn't necessarily the way people approach their health. And it's not just First Nations people. I mean, First Nations people are very good at appreciating that there's more to what's going on with them than just themselves. There's other things, there's other ways to do it. And a lot of other people are that way too. I mean, it takes more than just what I can provide them to help them deal with whatever they're dealing with. And I have to approach every person that I deal with that in mind.